Hello ladies and gentlemen, moms and dads. I am Dr. Dale Volquartsen, pediatrician out here in DeFuniak Springs, proud member of White-Wilson Medical Center pediatric team. Today I have been asked to discuss my least favorite subject, snot. First of all, the natural course of history of a common cold, upper respiratory infection. All right, this is caused by a virus. And these viruses usually start with just some simple, clear, runny nose, runny, no big problem. It gets worse over the first 3 to 5 days. That's usually the worst part. And as it gets worse, it draws more and more white blood cells to the nasal passages to fight off that infection. So it does get thicker, and the color does tend to change. The color is dependent upon more things like hydration status and how long you've been having these cold symptoms than actually the severity of the infection. All right, a lot of people think green snot equals infection. Well, there is an infection, but not necessarily bacterial. There's no studies that have shown that certain colors or correlate better with bacterial infection versus viral. The typical cold will last a week, 10 days, shouldn't last more than 2 weeks. And it tends to taper off with time, with usually that little drainage in the back of the throat. Typically we get concerned that it may have turned into perhaps something more like a sinus infection when you're not getting better, or it persists well beyond that 2-week period, and they usually have some other symptoms associated with it, like headaches, sore throat, bad cough that's not getting better, or halitosis, bad breath. What do you do when your kid has this draining nose and it's keeping them up at night? I wish there was a good answer, but there isn't a very good answer, and I'll be honest with you. Cough and cold medicines are no better, and maybe even worse, than just a teaspoon of honey. What we recommend is keep them well hydrated. If you're able to elevate the head of the bed, do that. It's kind of hard with some small infants, but older children you can. And for the child who's not able to blow their own nose, we have the parents do that for them. We usually use some saline, not just a drip drip, but try to irrigate it out with some aggressive use of nasal saline and then suction it out. Most often, it's an annoying problem than a truly health problem. And if you need any further help, you have any questions, any concerns, we, the pediatricians of White-Wilson, are here to help you, to walk you through these times where you have questions and you're not sure, is my child really doing well? We'll be here for you.